Good evening. My name is Ilia Young, and my informative speech tonight is on the community health worker and the health team and how they work together. Have you ever heard of the Native American medicine man, China's barefoot doctors, the worldwide renowned midwife? CHWs are similar to the community nurses of our past. They understood the need of their community to be healthy in order to communicate and to contribute to their daily living in society. These past CHWs bridged old traditions to new ones to help their communities become educated, stronger, and healthier. Community health workers decreased medical costs by preventing ER visits when CHWs could have been present to educate target groups, bridging resources to patients and saving the medical field unnecessary treatments and costs. The main points I'll discuss tonight are the costs associated with unnecessary ER visits and preventable disease treatment. Then we'll connect the need to assist those in most need for special medical attention and why it's important. And lastly, we'll try to understand the link between medical inequality, needs, support, and costs. The annual cost savings associated with the use of CHWs. The CDC informs us that preventable disease like obesity, with 147 billion costs per year, diabetes costing 327 billion a year, and heart disease costing the health system 199 billion per year, are preventable diseases CHWs, such as myself, can help manage lowering costs. Research by the American Medical Association, co-authored by Mathis and Henry, on the associated costs of the CHW and preventable ER visits in 2014, explored how hospitalizations dropped by 12.6% among patients with diabetes and other chronic health problems. There's also a net savings of $1,135 per patient, and there's a net savings of $170,213 annually generated by each CHW. The improvement led to the hospital achieving the additional $250 per member per month enhanced reimbursement rate for care coordination. So CHWs help prevent disease and unneeded visits to the ER and doctors by determining the needs these communities have and educating patients to resources before visiting the ER. As said by the Center for Disease Control and Prevention in 2019, the CDC offers links and resources for CHWs to continue to learn and assist their medical team and the communities. So it's not someone who's just coming off the street saying, I want to help. In some states, we must become certified as a community health worker in order to serve. So how do we connect to our underrepresented and underserved communities? The National Association of Community Health Workers states that CHWs are the intermediary between health, social services, and the community to facilitate access to services and improve the quality and cultural competence of services delivery. Community health workers wear many hats. We provide social determinant human services such as counseling, coaching, non-clinical medical support, and education, most of all. Community health workers are field workers that often focus to support the underserved population attain proper preventive health services. We speak their language, we have the same background, understand the inequality facing each other. We come from the communities we serve, so we have in some cases similar experiences that connect us in a unique way. We understand what the community wants and needs, and when doctors and nurses and social workers sometimes cannot be readily available or understand. Doctors and nurses are linked to the CHW. Doctors and nurses are mostly found in urban areas, and that's because it's densely populated and it pays better. The elderly might not see a doctor because they are without transportation means. The newly sworn citizen might not have enough insurance to cover regular doctor's visits. We're not in Europe after all, or still feel unsure about their newly learned language. Therefore, they will not seek medical help. Community health workers have become an integral part of the non-clinical medical team in reaching populations with different needs and under various health and living circumstances, providing services otherwise lost to these groups, which in turn drives the cost of medical treatment for unnecessary ER visits to us. In 2016, the Community Health Training Institute stated that CHWs work in screening and prevention, care coordination, non-clinical patient care and home visits, peer support and informal counseling, and identifying particularly at-risk health behaviors and educate. As you can see, determining social, financial, and cultural barriers of health and medical inequalities are key points medical professionals must take into consideration when deciding if we are valued for their space. So while doctors were able to come to your home back in the day, now we are there for you. First, we looked at some factors associated with the cause of unaddressed preventable disease education and unnecessary ER visits. Then we've also seen how the CHW contributes to the reduction of medical related costs. And thirdly, we have connected how the CHW and the medical team can work together to strengthen to strengthen community involvement in their own treatment plan and continue to build strong, healthy communities. In conclusion, we must understand the costs of care to the underserved population. And they need to educate them in a way that connects to their cultural roots by utilizing CHWs. By doing this, we're able to better control costs associated with the necessary ER visits or costs from preventable diseases. So go out there, ask your doctor, how can I get a CHW and stay healthy? Thank you.